My name is Lily. I'm the billing and office manager here at Community Health Resource Center. I just want to thank everyone for joining us for the first session of our three-part chronic kidney disease and nutrition series. Today we'll cover kidney basics and an introduction to kidney function and CKD stages 1 through 5, including causes, risk factors, and strategies for preventing kidney damage. In week 2, we'll dive into nutrition recommendations more deeply for CKD. And in week 3, we'll wrap up with practical food choices featuring renal dietitian and CKD nutrition expert Vanessa Connolly. I'd like to thank our partner, the National Kidney Foundation, for helping make this series possible. Before we get started, I'd just like to share a bit about our organization for those who haven't joined our programs in the past. Community Health Resource Center is a nonprofit here in San Francisco. We were established 40 years ago by doctors at California Pacific Medical Center to provide resources and care that would supplement their work with patients to support their overall health and well-being. Today, we have 4 main areas of service, and those include behavioral health, nutrition counseling, community health screenings, and health education. And this series is a culmination of 2 of our areas, which are nutrition and health education. This week, we're kicking off the series with Elena Zidaru, registered dietitian and director of our nutrition team. She's passionate about working in the outpatient setting and supporting her clients achieve their health goals. She provides individualized nutrition counseling for weight loss and disease prevention, as well as management of various medical conditions such as cancer, diabetes, chronic kidney disease, gastrointestinal disorders, cystic fibrosis, and more. Elena's goal is to meet clients where they are and help them set realistic, achievable goals for lasting health behavior change. And just as a reminder, the information provided in today's presentation is for educational purposes only and is not a substitute for professional medical advice. And with that, I'll go ahead and pass it along to Elena to get started with the presentation.
Hi, everyone, and welcome. And thank you so much, Lily, for your wonderful introduction. I'm honored to be part again of this webinar and class series that we do in partnership with the National Kidney Foundation. And actually, before we get started with the presentation for the first week, I would definitely like to have Doris Liu from National Kidney Foundation say a few words about the organization. And let me just share a bit my slides.
Well, while you go ahead and pull up those slides, let me just introduce myself. I'm Doris Liu with the National Kidney Foundation. I am program manager for patient programs. We at the National Kidney Foundation are fueled by passion and urgency. We're a lifeline to all people affected by kidney disease. We recognize it's not just patients, but also family members, the community, and many of those around you who are affected when you have kidney disease. We focus on the whole patient through the lens of kidney health because when your kidneys are not working well, a lot of part of you is not working well, especially the heart. So we are relentless in our work and we enhance lives through our action, education, and accelerating change. So a couple of services I just want to share with you. Elena, next slide. We have a patient helpline. So if you have any questions, we have NKF Cares, which is available by phone and email, and that is staffed by trained professionals. They can talk to you by phone, by email in English and Spanish. Our NKF Peers program allows you to talk to somebody who has been there. This is not just for patients, but even for people who are considering becoming a living donor. You can talk to someone who is a living donor and you have questions for a one-time consult or a ongoing meetings. That's up to you. And then we have online communities, which is basically like a chat group. You log on anonymously and you can ask your questions or just log on and see what other people are saying and questions they have and what others in the community are saying. So those are some things that we have and many more resources, and we will share more in the follow-up email. Thank you. Elena, back to you.
Thank you, Doris. And without further discussions, we'll go into our agenda for today, which is week 1. And my goal is today to talk to you about kidneys and basic kidney functions, the difference between acute and chronic kidney disease. We'll go over the stages of kidney disease and some risk factors. And at the end, we'll talk about the weight loss medication, GLP-1 receptor agonist, which, we're piling more and more information and evidence about how that can be helpful for people with chronic kidney disease. So I truly believe that in order to manage a chronic disease, it's important to try to understand that disease, right? Like the organs that they're affected by it and how everything kind of works in your body. And then this way you're more likely to understand why certain nutrition recommendations need to be followed, what can be helpful, what not, and the things that you need to focus on. I don't know how you are, but I usually, if you tell me exactly why I need to do something and explain to me how is that going to help me, I'm more likely to do it and stick with a recommendation versus if I don't understand what's happening, why is that important, I might not just do it. So this is the goal for today. It's kind of the foundation of following couple of weeks where we're going to dive in more the nutrition part of CKD. But we're going to start with just kidneys and what they are and how they work. So they're a pair of bean-shaped organs located below your rib cage, more like in the back. And they are pretty small, like a fist size. So they're not big organs, but they have an enormous capacity to filter. They filter from 120 to 150 quarts of blood in a day and produce 1 to 2 quarts of urine, which urine would be waste material and fluid together. So that's happening daily. I have here a bit of a picture where you see this red arrow blood from your body, it will enter your kidney through the kidney artery, and then it kind of goes around inside each kidney. We have about 1 to 1.3 million nephrons, which are the smallest unit, the cell of kidneys. And then those, each nephron will have this very complex, and I'll show you here, mechanism of filtration. That's right here with the glomerulus and capillary, which are the small, tiny blood vessels where the blood just flows. And then each of this is like a little device that will filter, right? So we have 1 to 1.3 millions in each kidney of those nephrons. And going back here, so after the blood enters your kidneys through the kidney artery, they go into the nephrons to filter the blood. Now the filtration, what it's going to do, your kidneys will separate what's still good and needs to be recycled to go back into your blood, and that will happen through this blue vein, the renal vein. And then the filter blood will return to your body with some good things that need to be recycled. And then the waste material, things that your kidneys decide to get rid of, will actually be collected, and you'll see here through those tubules, will be collected in this in ureter. Each kidney will have one, so we have a left and the right one, and finally the urine will flow into the bladder where it gets stored, and then finally will exit your body through urine. Through urination, the urine will leave the body, and the urine, as I said, it's a combination of waste material and water that was not recycled. It seems simple, but it's a very complex mechanism, and there are lots of things that the kidneys do. So the first part of this busy slide, I like more the pictures, but it's basically what I said with the blood enters your kidneys, the filtration happens, the urine kind of gets selected, and then some of the blood returns to your body. And then we need to kind of summarize and basically capture the main purpose and functions of the kidneys. So one is to keep the balance of electrolytes, sodium, potassium, phosphate. So the kidneys will regulate this balance of electrolytes and fluid, right? Because a lot of times the water follows those electrolytes. So keeping that balance, so sodium, potassium, phosphate are the ones that your body will recycle, will actually get rid of. So when the kidneys are not working well, a lot of times we hear about potassium or phosphorus going higher than normal and having higher than normal levels in your blood, right? So instead of being excreted, they kind of get pulled back into the blood too much, and that can create issues, health issues. And that's a sign that your kidneys are not filtering well anymore and not able to get rid of those electrolytes. The kidneys also would make hormones that are involved in the blood pressure regulation. Renin is one of them. And so this is a way, like through the production of this hormone, the kidneys keep that blood pressure regulated. So sometimes it's harder to control blood pressure if the kidneys are not able to to secrete this hormone. Another hormone that is secreted by kidneys would be erythropoietin, which is involved in the red blood cell production. So people that are having their kidneys are failing, a lot of times they have anemia because your body cannot really produce enough of those red blood cells. Lastly, your kidneys activate vitamin D. And vitamin D is very important because if we have enough vitamin D, then we're able to absorb better the calcium from foods and supplements. And that's very important for our bones to stay strong and maintain a good bone density through your lifetime. So all those are the functions that kidneys perform. So it's not, I would say, something quite impressive for two small organs that we have in our body. And I want to get into explaining a little bit the two different kinds of kidney disease, right? We have the acute kidney disease or acute kidney injury, sometimes called, that can happen in response to something. Sometimes can be a chemical or a medication, something that really affects your kidneys acutely. And early detection and appropriate treatment is very important, but the kidneys usually after that recover back to normal. So they recover their function back, the function gets back to normal, they recover fully. So someone, for example, as I said, has a reaction to a substance and then their GFR drops significantly. But then after treatment, that GFR bounces back to where it used to be, let's say in the 90s. And that's completely reversible, what we call, right? Versus chronic kidney disease, it's more some kidney damage that cannot be reversed and can also happens a bit more gradual. And the loss of the kidney function is more permanent, unfortunately. So it does not happen acutely with something bother your kidneys. It just can be more progressive. And we'll talk about causes for that, but it's definitely something that develops more in time. However, it cannot be reversed, but can be managed and slowed down with diet modifications. So that's an important thing that I would like to emphasize throughout our talk. But for example, if you have from that kidney function of 90 something that I mentioned before, in time, there's a decrease and your kidney function goes to maybe 58. So there's definitely a decrease and that can happen more in time. However, the likelihood for your kidney function to, return to 98 or whatever it was it's low, right? Very low, not quite possible. But I've seen people that change diet and lifestyle that could have their kidney function bounce maybe in the 60s or maybe even 59 to a 71 or something like that. So there can be a small recover of the kidney function, but not a complete back to baseline. So that's kind of the difference between the two of them. And now the detection of kidney disease, especially if the chronic one, it's a more permanent damage, it's important to detect it as early as possible and start acting upon, so then you can slow down this progression of CKD. So in terms of screening for CKD, we have blood tests. We're checking usually creatinine levels, and they usually go up with kidney damage. And then also we're checking the eGFR, estimated glomerular filtration rate. And that usually decreases. So as the creatinine goes up, the GFR goes down. And this is kind of the classic sign of CKD, and based on the eGFR, we could stage the CKD. There's also a urine test that can be done to actually test the presence of protein and or blood in the urine. Individuals with healthy kidneys do not have proteins or blood in the kidneys, in the urine. So sometimes having protein in the urine through that urine test, it's one of the first signs that can indicate actually a risk of developing CKD. Sometimes people have high protein in their urine, but their GFR is still in the good high level, maybe even stage 1 or 2. But this kind of presence of protein in the urine can signify that you have an increased risk of developing CKD and the GFR to eventually drop. And then, of course, if you were found to have protein in the urine, that would be good to do regular screening and checking of at least annually to see, how's your kidney function. The eGFR and the creatinine are part of the comprehensive metabolic panel. So the good news is the CMP, comprehensive metabolic panel, is actually a very standard part of the screening annual checkup that you do with your doctor. So it's not a specific test that needs to be, it's kind of part of a basic lab work that you would do annually with your primary care physician. So it's good from that perspective that it can be screened easily. Symptoms of CKD. I know some people wonder, well, would you know if you have CKD or not? And then unfortunately, CKD is one of those silent diseases like diabetes too and high blood pressure, where you can't really tell, your body is not going to feel in a different way. And not to say there are no symptoms at all, but typically with CKD, the symptoms will show when kidney disease is more advanced. So a lot of times those symptoms that are listed here happen usually when people have more stage 4 to 5. So it's a little bit late to kind of wait for the symptoms. A lot of times I tell people the best thing is like to screen and do annual labs with your physician and look at that creatinine and eGFR, check the protein in the urine, all those things. Because again, the symptoms may appear, but a little bit too late. And people typically feel more tired, have less energy, they have trouble concentrating, they have a poor appetite, trouble sleeping. They might have muscle cramping at night, swollen feet and ankles, because as I said, there's electrolyte balance and also can lead to retaining more fluid. And from swollen feet and ankles, you may have also puffiness around your eyes, especially in the morning. Another feature would be dry, itchy skin, and the need to urinate more often, especially at night. But again, those are also symptoms that can be linked with other conditions, and then also they tend to show a little bit on the later stages. So chronic kidney disease, CKD, it's a gradual progressive loss of kidney function over time, the way I mentioned. It's named the silent killer because often has no symptoms in the early stages. Now, the main causes of CKD are high blood pressure and diabetes, uncontrolled, I should say, uncontrolled blood pressure and uncontrolled diabetes. So when your blood pressure stays on the high levels, and then when your blood sugar is not controlled, given that you have diabetes, you're not able to have a good control of your blood sugar. And those two conditions, the uncontrolled blood pressure, uncontrolled blood sugar, are the ones that tend to affect the most of the time the kidneys. I mean, there are other causes too, such as glomerulonephritis. It's a kind of a inflammation of the glomerulus. The inherited diseases such as polycystic kidney disease, lupus, which is autoimmune, obstructions caused by kidney stones, tumors, enlarged prostate gland in men, and repeated urinary tract infections. So those kind of recurrent when people have over and over. Some of them can lead to more permanent damage of the kidneys. But again, those conditions can be part of CKD picture, but the vast majority will be high blood pressure uncontrolled and diabetes uncontrolled. If you remember the pictures I show with those tiny blood vessels, the capillaries, so think about if you have high blood pressure that's not very well controlled, kind of hitting those small vessels, you can imagine how they could break, right? And if you can picture the kidney, I like to kind of to say that to my clients so it's easier to understand. If the kidneys are these powerful sieves that they could filter quite a bit, and now you have more holes in your sieve, right? The sieve is not gonna filter that much, it's not gonna filter that well, because those tiny blood vessels can pop and get damaged with uncontrolled blood pressure. So stages of CKD, mainly based on a eGFR, the estimated glomerular filtration rate. So what is this glomerular filtration rate? It's basically the rate at which the blood is filtered through the kidneys every minute. So every minute, the rate at which a milliliter of blood is filtered through the kidneys, right? So then when the kidneys are not filtered as well, the eGFR is lower, right? Because if the kidneys will work well and will filter efficiently, will filter more, right, per minute, versus will filter less when it's kind of slowed down. And there's a formula to calculate GFR, and blood creatinine level is needed in order for that to happen. That's why it's called estimated eGFR, because it's a formula. So it's an estimation. It's not like a exact test that will test how much your kidneys will filter. So it's based on the creatinine level, and there's a formula, and you estimate that glomerular filtration rate based on it. The normal GFR ranges from 90 to 120. So a lot of people, when they have a healthy kidney function, they're over 100. Now we have these stages of chronic kidney disease with the GFR and the percentage of kidney function that's associated with it. So basically stage 1, which is kidney damage with normal kidney function, GFR is 90 or higher. Again, can be 100, 101. 120, when you have basically 90 to 100% of your kidneys are functioning, right? Then stage 2, it's a kidney damage with mild loss of kidney function. So 89 to 60, eGFR is somewhere between 60 to 89. And then that translates into 60% to 89% of the kidney is functioning properly. And then we have a big range, the stage 3, and it's split into stage 3A and stage 3B. Stage 3A, mild to moderate loss of kidney function when we have the eGFR between 45 to 59. And stage 3B, it's moderate to severe loss of kidney function between 30 to 44. And again, the percentages associated with that. Stage 4, we have the severe loss of kidney function when the GFR is between 15, 29 and less than 15. of kidney functioning would be the kidney failure, where people tend to, prepare for dialysis because the kidneys are not able to perform their job, basically. So that's the stage we want to definitely avoid. Now, the stage 3, the stage 5 CKD options, hemodialysis, peritoneal dialysis, kidney transplant. We're not going to, part of this presentation is more the 3 to 5 stages and how to actually slow down and the progression of kidney function so then people avoid dialysis. So we're not going to focus during this presentation on dialysis at all. Risk factors for CKD. So we have a couple of them, controllable, non-controllable. Under controllable, we have, as I said, diabetes, high blood pressure, heart disease, obesity. Non-controllable, some family history of CKD, age, which is usually over 60. People have higher risk of CKD. And race, there are some races that are more predisposed to have CKD than others. But overall, I actually encourage my clients to not focus on the non-controllable ones because there's nothing we could do about. So try to focus on the controllable ones where we have more power of decision and ability to make changes, right? So for people that have diabetes or high blood pressure, I would say this is one of the most important first steps towards your kidney health. Control your blood sugar, control your blood pressure. How do we do that? Well, it's a combination of medication and lifestyle. So blood sugar control, if we take that first, I like to mention you need to take the medications as prescribed by your doctor. If there are medications where you can tolerate or you have a lot of side effects and because of that you're not taking them regularly, then talk to your doctor. There are other options, especially for diabetes nowadays. There's just so many drugs and with different mechanisms of action that they can help managing blood sugar. So it's not just one option that we have. And if you have side effects or you can't tolerate, you're basically stuck. Talk with your doctor, find what works for you in terms of medications, and then monitor as directed. Try to do and check your hemoglobin A1C a few times a year. Some doctors like to do it every 3-4 months, some maybe every 6 months, but definitely if you have diabetes, more than one time a year. Lose weight if overweight. That's going to help you with better blood sugar control and healthier kidneys. In terms of eating per se, eat regularly. It's very important to have regular meals so you keep your blood sugar nicely regulated, kind of wavy, and you'll avoid the ups and downs. The spikes in blood sugar and the drops when your blood sugar is kind of like a roller coaster is not that good for blood sugar control. So we need to eat regularly. Breakfast should be eaten within an hour of waking up or so, and then meals and snacks should follow every 3-4 hours thereafter. So eating that regular, the regular meals and snacks, whatever it's needed to eat every 3-4 hours, it's very important for blood sugar control. And I say you don't have to have the same schedule. I know sometimes I work with clients saying, but I have different shifts, I work different times, or my weekends and my weekdays are different. And eating regularly does not mean that every single day you have to eat at the same time. It means that in respond to your waking up time. You wake up at 6, you want to eat by 7, and then every 3-4 hours after that. So you might eat then at 11, and then at 3, and then at 7. This is an example. Let's say it's a weekend or it's a different shift. You wake up at 10 a.m., then you eat by 11, and then again you eat every 3 to 4 hours after that. So that's kind of part of regular eating. It does not mean necessarily that you have to eat at the same time every day your meals. Very important, besides meal regularity, is balancing your carbohydrates with protein, fats, and fiber. So never eat a carbohydrate by itself. You want to eat let's say some rice, but also with a protein like chicken, cooked with olive oil. So you have some fat there too. And then maybe with some vegetables on the side. So you have extra fiber. So now this carbohydrate food, it's eaten with protein, fat, and fiber. And this way, the carbohydrate, the sugar in that carbohydrate food in the rice will actually be released more slowly, gradually in time, and will be more wavy versus a spike. If we just eat a bowl of rice on its own or a piece of bread on its own, because carbohydrates digest very fast, your sugar is going to be available in the blood in the next hour or so. So there's going to be more of a spike versus a slower, gradual release over the next 3-4 hours. So very important, balance your carbohydrates with protein, fats, and fiber. I always say also, like a piece of fruit. A lot of my clients say, oh, but fruit is healthy for me and doesn't have a lot of calories when I'm trying to lose weight. And I said, yeah, it's a great snack, but never eat it by itself. Have a handful of nuts with it, and actually eat the nuts first and then the fruit, because there's always more research studies showing that in order for us to blunt that spike in the blood sugar after a meal, the order of foods seem to matter. So if you have your vegetable first, your protein, and then your carb, your blood sugar is not going to go as high as if you would have first the carbohydrate and then the rest of the foods. So having a handful of nuts and then eating your fruit would be the best way to kind of have that snack. Choose whole grains when possible. This digest slower and minimize blood sugar spikes. So the carbohydrates that you eat, they will have the fiber built in them. That would be more helpful and healthier. So, for example, brown rice, wild rice, quinoa, buckwheat, whole wheat bread, whole wheat pasta, those kind of grains will be better than the white rice, white pasta, white bread. The white potatoes, maybe get potatoes with the skin and some vegetables, mix in this way you get more fiber. Limiting refined carbohydrates and simple sugars, it's a way to kind of avoid those spikes that can happen. The simple sugars are already digested, broken down, and they can absorb into your blood very fast. So let's say if you have something sweet like jelly beans or, especially when there's no fat or protein in that sweet dessert, that sugar will just go into your blood very fast. Some of the worst in terms of spiking your blood sugar would be things like sodas, sweetened beverages of any kind, including sweet coffees or coffee drinks or juices, even the natural juices, 100% natural with no added sugar. It's a very concentrated form of sugar from the fruits in a liquid form. So that means empties your stomach very fast. There's no chemical digestion needed because they're simple sugars and they're going to be available in your blood, spiking your blood sugar in a matter of 15 minutes at the most. So limiting the simple sugars and refined carbs would be great. Exercise regularly, because exercise is a way for our body to use that sugar from the blood for the muscle cells to fuel them. So each time you contract your muscles, your body clears sugar from your blood. So and will allow the muscles to use that sugar to fuel the muscle cells. And then control the amount of carbohydrate consumed in each meal. Spread them evenly throughout the day. So it's not about not eating the carbs or having to be on a keto diet. You could eat carbohydrates, but ideally, again, balance them, eat them regularly, balance them with protein, fat, and fiber, and also don't eat too much at once. Spread them more throughout the day instead of eating a big portion at once. Blood pressure. How do we control the blood pressure? So understand the goal from your doctor. I mean, for a lot of time, cases would be less than 130/80. If your doctor decides to have a different target for you based on your family history, personal history, that's good to know that. Maybe even checking with your doctor, what's my exact target for my blood pressure if you have high blood pressure. How to manage blood pressure. You take, again, the medications prescribed by your doctor, and there's the same conversation with diabetes. If you have side effects, if you feel like those side effects actually impede you from taking them regularly, please talk with your doctor. There are many classes of medication for blood pressure, and there are some other options. Check blood pressure regularly until you know it's stable. I would recommend to check it at home at different times, so then you actually keep an eye on, and you're not just capturing the numbers at the doctor's office, especially when it used to be higher and you're trying to effectively lower it just for a while, right? You don't have to every day of your life to measure it, but sometimes people say that until I figure out that it's well controlled and my medication and my lifestyle kind of helps with that, I need to check it and make sure it's consistently low each time I check it. Exercise regularly. Exercise is an excellent way to lower blood pressure, and it works very well. I had a lot of clients that had very good results from exercising regularly. Exercising regularly is more important than just exercising intensely or a lot. Just that creating those habits and being able to stick with a routine is more important than exercising sometimes and more intensely, right? So it's important to do what works for your body, but do it regularly. Stress management can be very helpful. Unfortunately, stress can affect your blood pressure, can affect your blood sugar too. And I didn't mention that before, but so managing stress can help you with those two. Lose weight if overweight. It's a direct correlation between losing weight and improving blood pressure. And then from a diet perspective, reducing sodium intake and being able to monitor. Again, reducing sodium intake does not mean you cannot touch salt or you should not eat any sodium. We have a budget, and that's usually around 2,000 milligrams for most people. So, as long as you stay within your 2,000 milligrams of sodium a day, your blood pressure can be well controlled. Sometimes people can drop from 4,000 to 2,000 and they see big effects. So just by lowering from where you are to a level that's just better for your blood pressure, it's gonna show. DASH diet is what we call dietary approaches to stop hypertension. Was part of a study that was in the early 90s and really showed very positive effects on blood pressure regulation. So DASH diet, what it entails, reducing sodium, but at the same time, having also a reduction in sugar, saturated fat, and people eating more fruits and vegetables, so a bit of an increase in potassium and calcium and magnesium. So by reducing sodium and increasing those other minerals in your body, that seem to be kind of the perfect way to balance and control the blood pressure. We're going to talk more next week about DASH diet and Mediterranean diet and all those diets that can be helpful for reducing blood pressure and CKD. So ways to manage CKD, increase physical activity. We talked about that. Of course, if you have any body limitations or injuries, it's good to check with maybe a physical therapist or a doctor before starting an exercise program. Again, activity can happen in different ways and can be very helpful, but it's not something that fits everyone, right? It doesn't necessarily mean go to the gym, hit it hard, sweat, or lift a lot of weights. Like, it needs to be individualized, right? And there are lots of options even for people with physical limitations and at different ages. So I always encourage people to think as activity of it needs to be personalized, right? It's very important for CKD, for blood sugar and blood pressure management, but it needs to be done in a safe way. Limit sodium, control blood sugar, blood pressure, quit smoking if you smoke. That's also very important, and that can reduce the inflammation in your body too, and reduce alcohol consumption to 1 drink a day or 2 drinks a day as a male, if you're female versus male, or even less. I mean, those recommendations are a little bit, they're basically for many, many years what we call a moderate alcohol intake, right? 1 drink per day if you're a woman, to no more than 2 drinks per day if you're a man. But in reality, I tell people you don't have to, if you're a man, you don't have to have 2 drinks a day every day, right? You could even do less and have less, and that could probably likely be beneficial, but for sure no more than that. And then modifying diet, more to come next week. We're going to talk specifically next week about protein, sodium, phosphorus, and potassium, and how that can be different for people at different stages. But in general, those first 4, right? Increase physical activity, limit sodium, control blood sugar, blood pressure, if you have diabetes or high blood pressure, and quit smoking, reduce alcohol, are just things that could help anybody with CKD. And then the further diet modification can be, again, individualized based on labs, based on everybody's clinical picture. Some people may need to restrict certain things more than others. What I want to show you, and this is for now almost 10 years ago, I can't believe, this article in Journal of Renal Nutrition from January 2016, that research shows medical nutrition therapy has a role in slowing the progression of CKD, delaying the need for dialysis, and improving nutritional biomarkers. So we have for at least 10 years this proof, right, that the nutrition and diet can be helpful in actually slowing down the progression of CKD. But unfortunately, I still hear clients saying, well, my doctor said there's nothing I could do about, we need to monitor the labs. And I would like for that to change, and for people to understand that, yes, there are diet changes you can make that could be positive and beneficial to slow down the progression of CKD. As I said, we cannot completely reverse, but we can definitely manage the way when somebody has diabetes, will have diabetes, but they can manage their blood sugar. And then the diabetes is not creating a lot of issues and problems in your body if you manage that blood sugar. The problem with diabetes is also when the blood sugar is not controlled, that's when it can affect different organs and create more medical complications. So the diet, the activity, just lifestyle in general has a role. And I want for that to be one of the big messages for today's session. Now, we have nutrients of concern that we're going to talk in detail next week. Sodium, phosphorus, potassium, protein, and fluids. Likely going to talk more about physical activity too, because as I said, it's very important. And independent of controlling blood sugar and blood pressure, it can help with kidneys health. So let's say somebody doesn't have diabetes or high blood pressure, may have maybe, polycystic kidney disease, or may have IgA nephropathy, or, there are other conditions that can affect the kidney function, and that physical activity would still be a beneficial lifestyle factor for the health of the kidneys. So my last part of the presentation, because also I want to make sure we have more room for questions in next week and the following week. So week 2 and 3, they're a little bit more dense in terms of materials, and we might not have as many, as much room for questions. But I was figuring out that if today we're just introducing the kidneys and the kidney function and kidneys roles, we may have more time for questions. I know some of you already sent a lot of questions, and I know probably there's some more that people have today. So I'll try to spend the most 10-15 minutes with the last slides about the GLP-1s, and then after that, we'll have about half an hour of questions. So the weight loss medications, GLP-1 receptor agonist, glucagon-like peptide-1 receptor agonist. That's the whole name of those GLP-1s. So what they are, they mimic the effect of the GLP-1 hormone that our body, our gut secretes after eating. So we have naturally in our body this hormone that gets secreted after a meal. But basically, when you take an agonist means something that enhances or does the same thing, right? So basically, you get a bigger response of this GLP-1 when you also take the medication. And it helps secrete more insulin from the pancreas that can lower blood glucose. So that's one of the role, to secrete more insulin. So I want to explain, because maybe not everybody knows what insulin does in our body. And some of you may know that, but after a meal, it's normal. We're eating carbohydrates. It's normal for our blood sugar to go up. That happens in everyone, regardless if they have prediabetes, diabetes, or not. So your blood sugar goes up, and that's the trigger for your pancreas to say, oh, I need to secrete this hormone, insulin. So the pancreas secretes insulin that is a hormone. So that means travels in your blood and acts upon different cells. And traveling in your blood, the insulin is kind of like a key. Each cell in your body has a receptor where the insulin goes in like a key and opens the door of the cell for the sugar in your blood to go inside the cell and fuel the cell. Because that's the role of the blood glucose. It's fuel for our cells that we have in our body. So basically, this insulin, it's a key, it's a facilitator, helps facilitating this entrance of your glucose from your blood into the cells. Now, after somebody that has no problem with blood sugar regulation, again, you eat a carbohydrate meal, your blood sugar goes up, you have keys coming, opening the door, everything kind of normalizes, the sugar in your blood goes back to normal. Now your body gets rid of the insulin in your blood, and you do that after each meal. When you develop prediabetes or diabetes even, it shows that you have a decreased ability to handle this process and metabolize the carbs properly. In fact, what happens is that there are two things that sometimes they're combined, and it's a combination of both. You either don't have enough keys coming from the pancreas. Your body has less production of insulin, so there are less keys coming to do that job. So then your body cannot clear the sugar from your blood after a meal as effectively as before. But a lot of times it's more that your cells develop insulin resistance. So they don't recognize the key anymore. And that's a problem because you get enough insulin, the keys are coming in, but they're not working to do their job. Now your pancreas thinks, we don't have enough keys, let's create more, right? Because your blood sugar does not get clear from the blood. And then your pancreas will pump more and more insulin that in time will deplete your insulin stores. And then also now you have a higher level of insulin circulating in your blood, right? Because you're creating more. And that can actually promote weight gain and facilitate weight gain because it's an anabolic hormone, promotes growth and fat storage. So it becomes a vicious cycle right now that people now gain also weight, and then their cells are more insulin resistant, not recognizing the key. So you could see how in between the insulin resistance or not having enough keys, this GLP-1 drug that helps you secrete more insulin from the pancreas can be helpful. Another mechanism of action of the GLP-1 is to prevent more glucose from going into the blood by blocking glucagon secretion. Glucagon is the hormone that raises blood sugar, because we have a hormone that lowers blood sugar and one that raises it, and and they need to be in balance. But basically, Another mechanism of action of those GLP-1s is to block the glucagon so that you're not secreting more sugar from storage. Also, it can slow your gastric emptying, and that's why people sometimes experience nausea with those medications. So the gastric emptying, how fast the food gets emptied from your stomach, slows down. But that also can slow down how fast your sugar gets into your blood, right? What we were talking about, those spikes after a meal. If the digestion takes a bit longer, you're actually less glucose gets released into the blood at one time. So you're avoiding those spikes. And then also can increase satiety from a slower gastric emptying, but also from the GLP-1 that affects area of your brain that process hunger and satiety. So there's definitely a clear action or activity on the satiety and how we perceive hunger and satiety in our brain. And that's why a lot of people say, I'm not actually hungry. I'm not that interested in eating, or triggered by food. As some people are more sensitive and they describe a food noise in their brain, and then with those medications, that food noise quiets. Types of GLP-1 medications, they've been around for a long time, and those are the different types. But the last three, the semaglutide injection, Ozempic or Wegovy, Ozempic for diabetes, Wegovy for weight loss. Then we have the semaglutide tablets, Wegovy tablets. Rybelsus was more for diabetes management, and Wegovy pills were approved this year for weight loss specifically. And then you had the dual GLP-1 combined with the GIP, which is a glucose-dependent insulinotropic polypeptide. It's just another hormone in our body that could help with satiety and hunger regulation. So those are the tirzepatides, Mounjaro for diabetes, Zepbound for weight loss. So those three, the last three, are the last classes in the newer GLP-1 versions that seem to be the most effective for weight loss. The upper ones that have been used for a long time, mainly for diabetes management and blood sugar control. They did not seem to have that much of an effect on weight loss the way the last three have. So potential benefits of GLP-1s: lowering blood glucose, weight loss, reducing risk of heart disease and kidney disease, improving lipid disorders, improving fatty liver, lowering blood pressure. So far on the last 5 years or so, there's more and more studies kind of seeing all those effects on health. So more to come. It's still a little bit new, right? Because they haven't been around for that long, especially the last three that I mentioned. Now, specifically with CKD, we had over the last few years, maybe the last 2 years or so, I added to my presentation because it's been shown to slow the progression of diabetic CKD. Through some mechanism, may protect the kidneys by reducing albuminuria, reduce blood pressure, slowing the eGFR decline, decrease inflammation caused by ages, which are advanced glycation end products. It could be they can be pro-inflammatory in our body, and I could talk more about next week. May improve endothelial function, may support beneficial changes in solute exchange in the kidney's tubules. So when I show you that picture, when the blood flows and then the urine gets collected in those tubules, and then some of the things get recycled back into your body to leave through the renal vein. So all that exchange seemed to be improved by those GLP-1s. So then making those solute exchanges more beneficial. And there was a review that I actually listed in my reference at the end of the slides today from 2026 that notes that CKD progression was slow by approximately 3 years, and in some cases prevented with people using the GLP-1. So I think more to come in the last, I would say, 2 to 3 years. We've had some good evidence that can be beneficial for someone with CKD. So especially if you have diabetes, high blood pressure or heart disease or high cholesterol, you're overweight, and you have CKD, I will talk with my doctor about the role of those being on a GLP-1 medication, and because seems to be beneficial to slow down the CKD progression too. Which again, this is a newer thing that I'm kind of talking about. I've been doing those webinar series for I think the past 8 years, and I'm always excited when I see that I'm adding things and more information that we discover through the years. So that's why also I wanted to make it part of the presentation. Well, potential side effects, of course, there's always side effects with medications. The more common is the loss of appetite, nausea, vomiting, diarrhea. So the loss of appetite is expected based on what I said, how those GLP-1 work in our body. Nausea also because of that delayed gastric emptying. Now, of course, it's a difference if you're nauseated all the time and you don't feel well versus you have a bit of nausea maybe the day after your injection and it's tolerable and then it kind of goes away. That's more the pattern that I'm looking for. So if you're nauseated all the time, that may be just a side effect. You might not tolerate it well, or maybe you need to be on a lower dose. Vomiting, diarrhea, for sure, vomiting is not good. If it happens, you need to check with your doctor. Diarrhea is a side effect that can happen more at the beginning, and people that it just kind of goes away. Or I had clients saying that when they eat too much fat or fatty meals, they tend to have more diarrhea. So adjusting the diet sometimes helps with that. Less common indigestion, headaches, dizziness, increased heart rate, infections. I'm not hearing about those regularly from my clients. And then you have some severe side effects. They're very rare, but can happen, like pancreatitis, thyroid cancer. In the studies, there were some associations that were made with the increased risk of thyroid cancer, acute kidney injury, which of course won't be a good thing. Worsening of diabetic retinopathy and gastroparesis, when it kind of affects how your stomach moves the food, into the small intestine. So it should be a rate. We expect a delay in the gastric emptying, but gastroparesis is a very extreme kind of delay when the food does not really move anymore and you feel pretty sick, nauseated, vomiting. So those again are more severe side effects and rare. So if you have more questions, you could talk with your doctor about those. Now, nutrition tips for people on GLP-1 receptor agonists, very important. You need to eat more protein to help with fullness, muscle mass. Now, more protein does not mean a ton of protein. Especially with CKD, we'll see next week that protein is a nutrient that you need to pay attention to not excessively eat. But when I say more protein, you want to make sure you eat enough to preserve your muscle mass, right? Because as you're losing weight, you could lose more muscle mass than intended when you're not eating adequate protein. More doesn't mean excessive, but just means you need to eat enough protein to prevent muscle mass loss. Eat mainly whole foods. This would be a good thing. So try not to, especially now, if you eat less, you want to prioritize the more nutrient-dense foods, right? And be able that with the calories and the food that you're able to eat, you're eating more nutritious food, so then your body is able to get all the nutrients it needs. Limit processed foods, fried foods, or things that we call empty calories, right? They give you some calories, but not a lot of nutrients. Sugary drinks, alcohol, refined carbohydrates, things like that. Drink enough fluids, at least 8 cups of water a day. It helps with hunger and nausea. And then eat regular meals and smaller, more frequent as needed to control hunger. So basically, a lot of times people don't want to eat and they don't eat, which is not good. You still need to eat your 3 meals, even though they're smaller. That's okay. That's how you lose weight, but you still need to keep your meals regular and happening. So don't skip meals. So my personal observations from my personal experience working with patients on GLP-1 receptor agonists, no magic pill. I mean, the diet, lifestyle, exercise still matters. You want to eat right, again, prioritize the nutrient dense foods, exercise so you preserve that muscle mass and you don't lose muscle mass. For people who used to experience hunger throughout the day and think about food very often, again, having that food noise and feeling hungry all the time, wanting to eat all the time, definitely a huge help. I've seen those people benefiting the most because it can just quiet that food noise. It can help you just eat regularly without overeating, without grazing throughout the day. That can be very helpful. May not help as much with emotional eating. I mean, it helps to some extent. A lot of my clients will say, I don't have as many cravings, or if I have them, they're not as intense and I can resist them a lot of times. But that emotional eating as an expectation to my clients is it's not going to go away completely, right? So if you feel the need to eat something just to soothe your self-comfort or the stress at the end of the day after a stressful day, that may still happen. You may still have that desire to do that, but it's definitely more toned down, not as intense for people that are more emotional eaters. And then eat regular meals 3 times a day, again, can be smaller, but do not skip meals, as I mentioned. Those are some of my observations and advice that I give to people. I have some references here that I mentioned, and I know Lily will send the slides so you can use them, have them, check them. And I think we're ready for questions, Lily.
Wonderful. Thanks, Elena. That was great. I'm gonna pop into the Q&A here just a minute. Okay, first question here. And I know you went over this a bit, Elena. Can your numbers fluctuate with your kidney function, or do numbers typically gradually increase over time?
Yeah, that's a very good question. And I was looking at that as the one appropriate to answer today too. So yeah, no, the numbers can fluctuate with your kidney function. So for example, I've had clients having higher creatinine, lower GFR, but then, the creatinine can decrease and the GFR can increase and improve to some extent. Definitely, there are fluctuations with that. And, so this is kind of the whole idea behind we can reverse completely CKD, but we could stop it what it is, improve it a bit, and not allow it to worsen, basically. And worsen would be creatinine gets higher and higher, and GFR gets lower and lower. And I've had just clients like that, just being on this maintaining and slightly improving kind of pattern.
Thank you. Kind of in the same vein as managing GFR, do you know of any kind of at-home tests for tracking eGFR?
I'm not aware. I don't think there's a way. And as I said, GFR is a calculated measure. It's an estimated, and it uses creatinine. So unless maybe Doris or if you know about something that I don't know, but from my knowledge, you cannot really monitor it at home the way you do with blood sugar or blood pressure. Yeah.
Yes, none that I am aware of either.
Yeah.
Okay. Thank you both. And back to kind of improving kidney function. I know you also went over this a bit, Elena. Can kidneys improve or heal with proper diet and exercise?
Yeah, they can improve, as I said, to some extent. There would not completely, as I said, from a GFR of, let's say, 55, will not bounce back to 100, but can improve. And I think I've seen, I don't know about you, Doris, again, if you maybe have more experience, but I work with the with a number of patients with CKD that I was able to work more closely and see improvements up to 15, maybe 20 points in the GFR. So let's say from 55 to maybe now 70 or something like that, or from 43 to 55 or 59 or, something like that.
Great. That is very promising. And you can tell me if this is, maybe better for another week or out of scope. Are there any proven supplements that can stabilize CKD stage 3A or CKD in general?
No, unfortunately, there's no proven supplement they would specifically do that to, basically stabilize or improve. It's nothing that I could tell you, unfortunately. I wish it was, that people would just be able to take a supplement and help with that, but none proven.
Got it. Thank you. And I'm going to jump into the audience questions for today. Those are sort of the pre-submitted ones that make the most sense for today. And then if anyone submitted a question in the registration that was not answered, it likely just is better suited for weeks 2 or 3. So we'll save that, but we will be sure to answer all of those pre-submitted questions. We have someone here in the Q&A who is receiving many blood tests. They are stage 3A for the first time, and their PCP is not too concerned given their age of 86. Is this something you've seen kind of as a common phenomenon? Excuse me.
Oh, yes, very common. And also, I would say not even for someone at 86, for someone that's maybe 50 something, 60, or, pretty common not to say much or be too concerned. Some doctors also say there's nothing you could do or you need to do, just let's monitor this. So that's common too. And that's sometimes part of this was about 8 years ago or so, what kind of sparked our interest to create this series, because we had sometimes clients frustrated with, well, I didn't know this was happening until my doctor started talking to me about dialysis, and I was like stage 4 to 5 already. And I look back at labs and it seems like those numbers were dropping, or the GFR was dropping for a long time and nobody kind of said anything, or, it's part also of so the eGFR, it's not going to be flagged as abnormal unless it drops under 60. So like 59 would be the first number that would actually be flagged as abnormal. But if you remember the slides I had, that's already stage 3A, right? So a lot of people may not even know they started to have a decrease in their kidney function until it gets flagged as abnormal, and that's stage 3A. And again, not to say that's advanced or, oh, what I'm going to do now, I'm going to, you have to think of dialysis or anything like that. No. In a way, with age, there's some loss of kidney function that will happen. Like anything with age will start to not work as well in our body. But again, unfortunately, sometimes that happens at earlier ages. So then you have to kind of be proactive and say, okay, I need to make sure I know what to do to protect my kidneys to stop this or slow down as much as possible this progression. Because the thing is that at that level of, remember I said about 60% of your kidneys will work, the kidneys can work very well and filter and perform all their jobs at that level, right? You're not going to have likely any side effects, and then your body can function well. The problem is that sometimes, depending everybody's story and lifestyle, things will progress, and sometimes can progress fast and sometimes can progress on a slower rate, but still progress. So the idea is to not completely dismiss it or say, oh, it's nothing to worry about. It's like trying to figure out what I can do about slowing down or stopping the progression of CKD. I hope it makes sense. I know it's not but it is for you being 86 and having stage 3A. I mean, yeah, you could still pay attention to certain things that we're going to talk next week. Maybe lowering your sodium intake, making sure you're not eating excessive protein, making sure you're hydrating well, exercising. I mean, all those things will help you keep your kidney function the way it is, because again, your kidneys work well at this level, but this will ensure that in the next few years or several years, your kidneys are not gonna damage further.
Wonderful. Thank you. We have another question here about diverticulitis being associated with CKD and the foods varying substantially, or the nutrition recommendations for each condition. For example, with CKD, you may be able to eat certain foods, but those same foods might trigger diverticulosis or diverticulitis. Do you have any resources or kind of experience working with patients with both conditions, and any kind of nutrition recommendations for managing both?
So it is an interesting question, and I don't know the whole clinical picture, right? So it seems from what I'm understanding that somebody has CKD, again, depending on the stage, and then diverticulitis, which again, it's a little bit maybe history of diverticulitis. So I think the confusion with diverticulitis and diverticulosis. Diverticulosis is a chronic condition when your colon creates those pouches where fecal material can actually kind of get impacted. And then in time, at one point, those can get infected, and then you develop diverticulitis, which is an acute episode. It's very painful and, kind of needs some medical attention. The diverticulosis is the chronic condition where you have those pouches in your colon. Verticulitis is when those pouches get infected and there's an inflammatory process happening and it's very painful. And then you need to be on a very strict diet for a couple of weeks or so, clear liquids, then very low fiber just to allow your gut to heal. After that, you want to increase the fiber and actually get back to a healthy high fiber diet to prevent those pouches from getting impacted again and infected, and to avoid this acute episode happening again. Now, we don't know exactly what causes the diverticulitis and how. I mean, we know why, because those pouches get, again, retain this fecal material and can pop a little bit. And what I'm not even sure exactly if they just get infected, right? It's a infection slash inflammatory process that happens, but we don't know exactly what causes that. And therefore we can't 100% prevent it, right? But we know that a high fiber diet that will help clean your colon and move things along, having good bowel movements, avoiding being constipated, drinking enough fluids. So those things can help, right? And the fiber that kind of acts like a brush in your colon. So with that, in a way, again, if you have diverticulitis, likely you had to have a strict diet for a few weeks, maybe a month. After that, I work with my clients to increase the fiber and get to a normal kind of more plant-based diet that would be healthy for your diverticulosis. And that also is very much in line with CKD, especially stages 3A, 3B, even 4, a lot of times. With 5, sometimes you might have to restrict certain things depending on the labs, like potassium or, so then some fruits and vegetables may not fit as well that pattern of more plant-based. But for earlier stages, that's usually a good diet. So for me, they will be in line at one point, with the exception when you had that diverticulitis acute episode. Yeah, but that diet that you have during that time should not continue for the rest of your life. It's just mainly, let's say, in the first month at the most of after having that episode. And if it doesn't answer your question, and if you need, you could always try to have a one-on-one session with a dietitian to just kind of work more specifically on your clinical picture, because from from this is what I got from the question, but there might be more to it, unfortunately.
Great. Thank you, Elena. And just quickly before I move on to the next question, I have someone here in the chat or in the Q&A asking to see the list of sources again at the end of your presentation. Do you mind just putting that screen up while we continue the Q&A?
Oh yeah, sure, no problem. I'll share the screen again because I still have it open to the resources.
Perfect.
Yeah.
Great. Thank you. Next, and I think you talked a bit about this in the presentation, is there one singular test that is most meaningful for chronic kidney disease?
I would say, I mean, I usually like to look when I had clients with CKD and just check their, labs or progression. I look at the creatinine and eGFR mainly. Yeah, those two would be the ones to watch in terms of seeing, am I progressing? Am I improving? Is it stable? That kind of thing.
Great. Thank you. We also have a question about a product called Zeva. Is this a good replacement for soda or alcohol for someone with stage 5 CKD? I'm not sure if you're familiar with that product, Elena.
It's Zeva, ZVA or Zevia.
That's maybe Zevia. That one rings a bell to me, but I'm not too
Yeah,
sure if
because Zevia is so they're like basically they're some soda that are sweetened with stevia, which is the sugar substitute. It's not an artificial sweetener, it's a sugar substitute that's kind of derived from a plant. And I know that brand because I had clients using Zevia. Sometimes it can be different products from ginger ale to just different soda flavors. And then the question again, I mean, I don't know if we can get the confirmation it's Zevia, but let's say it's Zevia because we might not have
yeah.
to
Yes.
be able to confirm in time if if we refer to Zevia versus Ziva, because I'm not sure what Ziva is. And then the question was if it's a good replacement of alcohol and
Yeah, if it's a good replacement for soda and alcohol for someone with stage 5. And for the submitter, please feel free to let us know if this is not the product that you were referring to.
yeah, and I think, I mean, in a way, definitely would be better, especially if that person also has diabetes and won't affect your blood sugar being sweetened with stevia. Also, stevia did not have the same with the studies kind of that were done with artificial sweetener did not show that can impact the much your gut microbiome the same the way actually some artificial sweeteners like sucralose and acesulfame, aspartame seem to. So if that person is also diabetic and they're switching from a regular soda or alcohol to that, I think that would be a positive effect. Now, it will depend also how much they're drinking. I would say I would still try to do moderation, maybe one a day, and try to drink more water. And also want to make sure, because I'm not familiar with all the Zevia products. I mean, there's a concern a bit with sodas in general for someone stage 5 from those phosphate additives that can be in certain sodas. Usually those are dark colas and drinks like that. They can have phosphate part of the ingredient list. So maybe I would check the product, the Zevia product you like, and make sure there's no phosphate additives because those are highly, as you're going to see next week, they're highly absorbable could affect your phosphorus levels in your blood more than even some natural phosphating foods. So I would make sure those Zevia products that you're drinking more regularly are not high in phosphate.
Wonderful. Thanks, Elena. Here. I think we have time for just one more question.
I think we do.
Great. This one may be more specific for a nephrologist to answer. We have one about where Jardiance fits in with CKD management.
Well, Jardiance is for diabetes, usually management, right? So the question is if Jardiance can also help CKD separate from just managing blood sugar as a blood sugar regulation drug, or
The question says, in regards to CKD, where does Jardiance prescription fit in?
Well, I would say, and again, yeah, maybe we could add that to a doctor's maybe, for a nephrologist question. What I know for Jardiance as a drug, it's used for diabetes management, so blood sugar regulation is the SGLT2 inhibitor, because as I mentioned, for blood sugar, blood pressure, you have different mechanisms of action, right, for those drugs. So this is a SGLT2 inhibitor, which don't ask me what they do. I'm not that versed in medication to tell you. I just know it's part of that class. And then, it's definitely used mainly in people with diabetes for blood sugar control. It can be, again, part of this SGLT2. I think my understanding, and again, we'll double check with the doctor, but some drugs like that can, in that category, are associated with slowing CKD progression and actually reducing cardiovascular death or cardiovascular related deaths. So the way I talk with you about the GLP-1s too, can affect blood sugar and weight, but also now seems to have a separate effect on CKD, slowing down the progression. So this is a drug in that category too that can do that. Now, I don't know exactly how much in terms of percentage, but it can be something added for someone with diabetes and CKD in their medication management because of that. And maybe, as I said, we'll have that question added for a nephrologist to confirm that. That's what I know.
Great. Thank you. And sorry to put you on the spot there with that one. We did get a follow-up that Christine is not diabetic, but prescribed Jardiance off-label. So
okay. So maybe, I mean, that even maybe shows that possibly because of that. Because as I said, it is a blood sugar, and usually I see it on people with diabetes, but if it was prescribed outside of diabetes, it might be just because of this effect. And honestly, I don't know. I mean, I know it can help, but I don't know. I would not be able to make that decision. I mean, I think it would be good to talk more with the doctor and have the doctor explain what's the kind of the, I guess, thinking behind it and how helpful can it be, how much in percentage can decrease the CKD progression, something like that. Because I don't know all that information, but I know it can help with CKD, decreasing the progression of CKD.
Great. Thank you. Well, that kind of brings us to the end here. Again, if your question was not answered, it's either better suited to be answered by a nephrologist or just more applicable to weeks 2 or 3. So we will save those and answer them accordingly. And then if any additional questions come up, you will see again when the webinar closes a link to a survey to fill out, and you'll have an opportunity to add any additional questions there as well. And again, if you submit that survey response, then you will also receive a link to the copy of the slides. And then I also just wanted to let everyone know that today's presentation was recorded, and we will post that recording and share it with everyone who registered for the event. Just to close out, I'd like to thank everyone again for joining us this evening. Thank you to Elena for leading this wonderful series, and thank you to the National Kidney Foundation for supporting us in putting this on.
And I'll see you all next week for more nutrition, digging in the nutrition part of our series.
Yes, we will see everyone next week. Take care.
Bye, everyone.